Hello. Our special guest today is Dr. Shira Fischer from Boston. Welcome, Shira.
Thank you. Pleased to be here.
Good. So today we're going to try something new in Israel Healthcare Highlights. We're going to hear from someone who basically lives in the U.S. but knows Israel really well. And we're going to hear from Shira what she thinks about some of the strengths of Israeli healthcare. But before that, Shira, please tell everybody a bit about your background and your current situation.
I'm Shira Fischer. I'm so pleased to be here. I work at the RAND Corporation. It is a nonprofit, nonpartisan research organization that provides leaders with the information they need to make evidence-based decisions. My early training was in biochemistry, and then I studied medicine, and I also studied clinical and population health research, sort of like epidemiology. After that, I did a fellowship in informatics, and I went on to work at RAND, where I do health IT, health information technology policy, and general health policy. And at RAND, we do all sorts of other kinds of work. They do labor and education and other kinds of efforts, but I focus on health policy. I've been there for about a decade of health IT policy and just general health policy.
Terrific. Tell us a bit about your connections with Israel.
I've been to Israel many times. I have family there, just like many American Jews. My family survived the Holocaust, and some of my grandparents' siblings went to Israel. And my grandparents came to America. So my mother has first cousins, and I have second cousins. My brother made Aliyah about more than a decade ago. So I have nephews and a niece in Israel. And I spent a year in Israel with Young Judea Year course when I was 18, and that was a very formative year and made a lot of connections there. And many of those Israeli friends who I met then and American friends who made Aliyah are now in Israel working in healthcare and in other fields. And I also spent a year in Israel on the Dorot Fellowship. Since then, my family and I spend most summers in Israel. And so we feel very connected. We've used the healthcare system, and we're familiar with what's going on politically, having experience a little bit of that ourselves. This summer, unfortunately, our trip was canceled because of the Iranian ballistic missiles.
That's great. So because you study the American health system, you have extensive experience with the Israeli healthcare system, you're a physician by training, you really have unique perspective on the strengths of each of those systems. Tell us some of the strengths about the Israeli system that you're excited about.
Sure. There are a lot of ways that the Israeli system is very impressive. And like you said, it's my inclination is always to compare because I see what we have in America and I see what we have in Israel. So one thing that certainly stands out and everybody is familiar with is just simply coverage. So in Israel, everybody has health insurance. Massachusetts, where I live, is actually a very high insurance coverage state, and was the model for the national ACA, or sometimes called Obamacare system, that requires people to buy insurance. But we're still not where Israel is, because in Israel, everybody has coverage and you can shift between one of four insurance programs, HMOs, but you always have to have one of them. And in Boston, in Massachusetts, even though we have a high insurance coverage and we have mass health, there are still many people who fall through the cracks, who can't get access to care. So that's one big difference. A second difference is the electronic record system, which is something that I am very interested in and follow closely. And America has come a long way in the past 10 years. There's been legislation that's required people to adopt it, or not required them to adopt it, but given them motivation to adopt it by having financial benefits for doing so. Electronic records are similar in some ways in the United States and in Israel, in that they track diagnoses, tests that have been done, and medical notes. But a big difference is that the ones in the United States are particularly designed around billing. So there's a real focus on making sure that things are coded correctly so that they'll be paid correctly, which is less of a focus in Israel. As well, in the US, we have healthcare systems that are not motivated to share data with each other. So they have to be motivated to do so because data is an asset that they don't necessarily want to share with competitors. This is not untrue in Israel, but there's more collaboration, there's fewer HMOs, and people are more likely to stay in the same system. So in the United States, sometimes people will get care in multiple places, and only recently has it been easier to share across institutions. So a database that you have from a single institution may not have a person's complete care. Whereas in Israel, the electronic records tend to be longitudinal, often go back as long as 20 years and have a much fuller picture of a person's experience. So for studies where you're assuming that the data you have is complete, it's a dangerous thing to do with US data, and it's much more complete in Israel. Israel has a longitudinal record for decades for many people because of the stability of people's coverage and because of the technology. It's just amazing the kinds of records that Israel has. So there are barriers in Israel as well when there's private hospitals or certain places where people can't necessarily get access to full records. But it was particularly informative or particularly good example around COVID vaccines. So the COVID vaccine in America, when Moderna was doing the trials, they had to do a prospective trial. They had to recruit people. They were able to get, I think, something like 40,000 people. It took a very long time, and they had to track them. Israel was able, in a very short time, because they already had access to the data, to get 1 million people, real world evidence, track them as they got vaccines, then as they got tests, whether they were positive or negative, whether or not they were hospitalized, which is part of the same system, whether or not they passed away, and all of their demographics and all of their comorbidities. So just so much more data available. There's also differences in how that data is protected. And even though the US has HIPAA, which is a privacy law, there's a lot of concerns about data being sold and data not being protected. There's a lot of concerns about data exchange. And then people talk about access, but I actually think that access in America is not as good as people make it out to be. People talk about wait times in socialized medicine. But I know that in Boston, which is supposed to be a very well, lots and lots of doctors and really high level medicine, there's still lots of wait times.
Now let's look at it from the other angle. What are some of the strengths of the US system that the Israeli healthcare system could learn from?
Sure. I mean, certainly we have a lot of expertise in America. And one of the fun things about being in Massachusetts is that we have a lot of trainees who come from Israel to get specialized training. And we see this particularly in Boston, but all over the US, that Israelis will come get specialized training and go back and maybe lead divisions in Israel. So we know that there's expertise here that is not available elsewhere. Certainly people come from across the world to get care at top medical centers. There's experimental treatments that are not available elsewhere. Sometimes people do bring them back to Israel, but it's harder as a smaller country. There's also a whole market for health tech that people seek out and see that the financial opportunities in America, because of the size of the country and because the type of reimbursement that they can get is better in America. So I talked to a lot of health IT companies that are looking to get into the American market versus elsewhere, including Israeli ones. I'm not sure that is the ideal situation. In other words, the higher pay may not benefit patients. It may be more about getting reimbursement, but there's certainly more motivation to innovate and get technology into the market because of the way that the finances are structured in the US. So those are a few things I can think about.
Sure, this has been great. Any parting thoughts you want to leave our audience with?
I often think that we could learn from Israel, but maybe not country versus country. It's very hard to compare the country the size of the United States to a country the size of Israel. And I think about the possibility of maybe experimenting with some of the successes that Israel has had, whether in terms of coverage or in terms of technology, more at a state level. Could we have some sort of opportunity? New Jersey is more the size of Israel, or Massachusetts, taking the kinds of models that Israel has developed in terms of care coordination, in terms of technology interoperability, and in terms of coverage, and think about it at the state level. That might be the right level at which to do the comparisons.
Wow, sounds like a lot of opportunities out there. Shira, thank you so much.